عرفنا ال principle of resuscitation. المحاضرة الثانية أخذنا ال respiratory issue أو ال most respiratory disorder in neonate سواء RDS أو TTN أو MAS. اليوم راح ننتقل إلى موضوع مهم اللي هو ال premature baby. ليش اختارنا ال premature baby to discuss؟ طبعا ال incidence of premature labor increase very much recently. أولاً لأنه ال incidence مالتها increase. Second cause because it's liable for a lot of complication. Premature baby is liable for a lot of complication and a lot of intervention we can do for him to survive. شنو هو ال premature baby؟ ال premature baby هو defined as a live-born infant delivered before 37 weeks from the first day of last menstrual period. احنا قلناها انه اذا مثلا 36 او 36 plus 6 days هو premature. 37 day هو first day in the full term. There are 3 subcategory of prematurity. اكو قسم يحبون يصنفون ال prematurity الى يعني more subdivision اللي هو extremely preterm less than 28 week, very preterm from 28 to 32 week, moderate to late preterm اللي هو from 32 to 37 week. Even the survival rate from infant born at 22 to 27 week have not increased since 1919, but the neurosensory outcome in survival has been improved. يعني ال incidence increase لكن عادة يعني ال survival rate not increase too much لكن ال morbidity and the complication diminished. Prematurity carry a lot of complication which lead to death or may cause a major disabilities. Preterm baby may need special care and follow-up. This care involves nursing care, medical care. That is to say, general care involves maintaining temperature, body fluid, cardiopulmonary status, gastrointestinal status, renal status, and other systems. In general, any newborn need a routine care and specific care. Premature baby need a very innate and very specific general care تتعلق بالtemperature, body fluid, cardio, heart status, GIT and etc. راح ناخذهم وحدة وحدة. طبعا أول شيء اللي هي incubation and humidity. We must keep the baby warm and humidified. طبعا humidified and warm incubator represent the best environment. Have an underdeveloped epidermis and stratum corneum. This increases the risk of high transepidermal water loss through the skin to the atmosphere, leading to temperature instability, dehydration, and electrolyte imbalance. Increasing humidity of the surrounding environment can significantly reduce these complications from occurring. طبعا احنا نعرف انه السكين اوف بريماتشور هو underdeveloped. من يكون underdeveloped يعني شو يكون liable for water loss. water loss ايش راح يزود لنا؟ راح يزود لنا الانسيدنس of electrolyte disturbance and dehydration. طبعا sign of dehydration in premature يعني حقيقة very difficult to know لأنه هو أساسا premature, skin emaciated, lethargy, small size. لذلك إنه إحنا حتى ما ندخل بهذا الباب أساسا يعني نحافظ على البيبي keep in warm و humidified. warm لأنه راح يكون heating loss عند أعلى liable for what is called cold injury and humidified بحيث الانكيوبيتر ممكن نسوي الهيوميديتي مالته يعني نسوي الانفايرمنت. احنا مثلا الانفايرمنت مالتنا هسه اللي مثلا قاعدين به هسه مثلا الهيوميديتي مالته في 20-30%. بالبريماتشور ممكن نوصل الهيوميديتي اوف ذا انكيوبيتر تو 90% 100% يعني بحيث نشوف الحاضنه كلها عباره عن ووتر بابل. The mainstay of care is to maintain the newborn in a neutral thermal environment, which ensure minimal metabolic activity and oxygen consumption are required to conserve body temperature. The premature newborn has the combined disadvantages of decreased fat. ما عنده fat فلا عندي heat production ولا عندي insulation عزل, decreased glycogen store, immature skin. كل هذه هي disadvantages feature. which increase water loss and poor vascular control. So premature newborn are more liable for hypothermia or what is called cold injury. Oxygen, we need to of course supply the baby with oxygen. Oxygen supplement is very important for premature. It must have been given to a newborn premature baby more than in any other medical product. In the past 60 years, despite this, we still know very little about how much oxygen this baby actually needs, or how much oxygen is safe to give it, especially in the first few weeks of life. Oxygen هو the mainstay and the cornerstone in the treatment or in the management of the baby with premature or RDS. لكن طبعا كلش difficult إنه ما راح نعرف إنه هذا البيبي actually إيش قد يحتاج أو إيش قد إحنا نطينا وسوينا له oxygen toxicity. Some diseases or condition like مثلا lung disease of prematurity اللي هي RDS which affect about 1% of a newborn infant, and this is the leading cause of death in baby who are born prematurely, can result in lower oxygen level and potentially cause serious and even fatal result. طبعا أكيد إذا ما أعطينا أكسجين يعني eventually the baby will die. طبعا هذه صورة للإنكيوبيتر اللي راح نحط به البيبي. طبعا كل الانسترومنت اللي حاطيها والاكويبمنت الفنتليتر الاي فلويد المونيتر. شوفون الحاضنه طبعا هي الصوره مو كلش واضحه. طبعا يشوفون الاير وابل مال الهاي هيوميديفايد انكيوبيتر. راح يشوفون هذا اللي يسموه نتس او العش اللي نحط به البيبي. طبعا هذه حتى keep the baby يعني secure انه طبعا البريماتور feel the handling يعني يحب انه ينشال، فنحط له هذا العش حتى يعني making him feel that he's يعني incubated and handled. The risk of RDS rises with increasing prematurity. طبعا baby born before 28 week have a risk of 60% chance of developing RDS. We can provide oxygen, supplemental oxygen, but this too can have a significant side effect, especially in a premature infant. هسه راح نشوفها بعدين. There are many types of oxygen supply and ventilation support on the baby unit. Mechanical ventilation through endotracheal tube, continuous positive airway pressure CPAP, nasal broke oxygen and incubator oxygen. خلي يعني هيك rapidly oxygen in the incubator. طبعا هذه ال type of oxygen supply. This nasal cannula supply. هذه ال broke of CPAP. وهذا endotracheal tube and connected to the ventilator. This is the type of machines. This is mechanical ventilation. This is a different type of CPAP. Incubator oxygen, the third mainstay يعني هي الانتيبيوتيك. Usage of antibiotic also very important as a preterm baby more liable for infection and sepsis. The newborn immune system exhibit a physiological immune deficiency in full term and preterm infant, but is more exaggerated in the premature and particularly marked in sick or stressed premature infant. طبعا عامة الانفانت سواء term أو preterm هو راح يكون immune deficiency، لكن premature infant more liable for immune deficiency. نضيف لها إذا كان sick or stressed premature also decrease the immunity. ليش decrease immunity؟ احنا نعرف كلنا إنه immunity in the human being هو two type humoral and cellular. الهيومر تتمثل بالimmunoglobulins. Immunoglobulins عادة transfers or the largest amount of immunoglobulin transfers in the last trimester. زي ما احنا عندنا أصلا premature labor فاحنا فقدنا إنه last أو transplacental transformation of immunoglobulin فقدنا واحد. line of immunity second line هو cellular immunity اللي هي تعتمد على T lymphocyte. T lymphocyte in the premature baby يسموها native T lymphocyte. يعني شنو native؟ يعني still immature. So immature it means it's more difficult to stimulate. So It's preferred to use empirical. لذلك احنا عندنا خطوط الاميونيتي كلها impaired, so it's preferable to use empirical antibiotic in form of penicillin and aminoglycoside. Fluid and electrolyte and nutrition management. These are important because most infants in neonatal care unit and ICU require intravenous fluid and have shift of the fluid between intracellular and extracellular and vascular compartments. Therefore, careful attention to fluid and electrolyte balance is essential. جدا مهم to keep the fluid well hydrated. If inappropriate fluid are administered, يعني مثلا هو احنا بدل ما نعطي fifth glucose saline مثلا نعطينا normal saline أو نعطينا glucose water, a serious morbidity may occur from fluid and electrolyte imbalance. ما عندنا البفرنج سيستم working efficiently to maintain or to stabilize the electrolyte. Inadequate attention to nutrition, يعني مو but just in the fluid and electrolyte, also the nutrition, zinc, vitamin D, may lead to growth failure, osteopenia of prematurity, vitamin deficiency, and other complications. Inadequate administration of fluid can result in hypovolemia, hyperosmolarity, metabolic abnormality, and renal failure. هذه إذا ما أعطينا fluid، زين إذا أعطينا excessive amount of fluid إيش راح يدخلنا؟ هم راح يدخلنا ب complication. Excessive fluid administration in very low birth weight infant is associated with patent ductus arteriosus, congestive heart failure, intraventricular hemorrhage, and necrotizing enterocolitis, and dysplasia اللي هي bronchopulmonary dysplasia. Complication of prematurity طبعا على رأس القائمة أكيد اللي حكيناها هي ال RDS أو respiratory distress syndrome. تذكير بسيط هو يعني تعرفون كلكم result of surfactant deficiency and underdeveloped lung anatomy. Respiratory distress is a clinical condition characterized by the presence of one or more sign of increased work of breathing. Tachypnea, nasal flaring, طبعا أي sign of respiratory difficulties in a premature baby نقول عليها RDS. طبعا occurring in the early life أو after birth, immediately after birth. Tachypnea, nasal flaring, grunting, chest wall retraction. It is vital to recognize these signs early and elevate respiratory distress in newborn because the patient can rapidly deteriorate to respiratory failure. RDS, then brain hemorrhage, neonatal intracranial hemorrhage, ICH, have 5 major clinical types. Subdural hemorrhage, primary subarachnoid hemorrhage, cerebellar hemorrhage, intraventricular hemorrhage, and intraparenchymal hemorrhage. طبعا عادة subdural and intraparenchymal hemorrhage تصير بالfull term, while subarachnoid, intraventricular, and cerebral hemorrhage more occur in preterm infant. Heart problem. Patent ductus arteriosus (PDA) is common occurrence in low birth weights less than 2.5 kg. The patency of ductus arteriosus in these infant is presumably a consequence of immaturity rather than embryologic abnormality. طبعا بنسوي echo study for premature baby. Most of them has PDA. عادة it is due to prematurity itself, يعني not due to structural abnormality. يجينا baby full term 40 week 4 kg نشوف عنده PDA حقيقة ما نقدر نقول إنه هذه structure يعني إنه هذه يعني for prematurity، لا نقول إنه هذه structure وممكن تحتاج يعني accordingly. مثلا إذا عندنا complex congenital heart disease نحتاج prostaglandin to keep it open or endomethacin its enhanced closure. طبعا عادة بالpremature هذا الحكي بالfull term ممكن نعطي endomethacin، لكن in the premature baby we give endomethacin if it is large and a significant PDA. Temperature control. Hypothermia at birth is a worldwide problem. Many studies highlighting that gestational age less than 26, core temperature less than 35 centigrade, it's mean يعني death, independently associated with death. Heat loss is a particular problem at resuscitation. طبعا احنا heating loss يصير طبعا during resuscitation, during transformation of baby from the OR or from the labor room to an ICU. incubator problem lead to heat loss. Preterm are more liable for what is called cold injury, and we know why. The best way to maintain the body temperature is kangaroo method. Kangaroo method طبعا هذه اعتمدوها recent years. شافوا انهم دول البيبي delivered in the African يعني بالدول الأفريقية liability for cold injury less. ليش؟ لأنه كلهم يستخدمون الكانجرو ميثود. طبعا شوفوا هذا البيبي هذا على فنتليتر يعني connected to the mechanical ventilation على تيوب، بس حاطي skin to skin baby skin to the mother skin. This is the best way for heat control and keeping the baby warm. And the same intestinal problem, bacterial infection of intestine lead to the inflammation and necrosis. The term of necrotizing enterocolitis أو اللي احنا نسميها مختصرها NEC occurring in 6 to 7% of very low birth weight infant. Present with the feeding intolerance. شو راح نعرف إنه هذا NEC؟ ال NEC may present with feeding intolerance. شو راح نعرف feeding intolerance؟ يعني ما ممكن يصير عنده vomiting. طبعا عادة احنا ما نبدي direct feeding وياهم NG يعني feeding through NG tube nasogastric tube. دول يصير عندهم intolerance يعني ننطي الفيدنج إنه بعد few hours supposed to be this feeding is past but it is still present. Blood in the stool, apnea, just apnea may be a sign of NEC, and other non-specific sign. هذه نشوفها طبعا بالabdominal X-ray اللي هي nematosis intestinalis راح نشوفها. It can result in the bowel perforation, septic shock, and death. We can minimize this by using breast milk, not bottle milk, for feeding. Delayed and careful justification of the amount of milk. طبعا ال NEC في شيء common in the premature baby. We can minimizing it by using specific or the best type of milk اللي هو breast milk, and the minimizing the أو justifying the feeding. يعني ما ننطي أول ما نبدي feeding نبدي whole time. عادة نبدي small و frequent amount. Then if the baby tolerance increase the amount of milk with days. هذه abdominal X-ray show the nematosis intestinalis اللي هو طبعا يكون air trap in the lamina in the wall of the intestine. طبعا very important and very يعني carry a lot of complication if it's not recognized early. Blood problem jaundice occur in 60% of full term, 80% in preterm. Jaundice increase in premature طبعا أكيد due to the decreased conjugation of in the prematurity. طبعا liver enzyme is not functioning well, increase enterohepatic circulation, and such as lack of adequate enteral feeding. ماكو enteral feeding يلا يعني يسوي لنا stimulation to the enterohepatic circulation. Include insufficient breastfeeding or infant is not being fed because of illness or GIT obstruction, and extravasated of the blood, encephalohematoma, excessive bruising, etc. Also, the preterm is more liable for bleeding due to immature clotting and coagulating factor that lead to DIC. Anemia of prematurity is very common, and we will discuss it later. Metabolic problem. The most common metabolic disorder in the neonate intensive care unit هي hypoglycemia. Preterm infant and those with intrauterine growth retardation IUGR are at higher risk for developing hypoglycemia in the first week of life because lack of sufficient glycogen and fat store, and also abnormal or decreasing feeding habit, which are normally accumulated in the طبعا fat which accumulated in the third trimester, and also because of decreased feeding or insufficient glucose supply. طبعا by يعني mouth is decreased, so it's more liable for hypoglycemia. طبعا هي كل الالكترولايت يعني ممكن تكون disarrangement in the premature hyponatremia, hypernatremia, hypoglycemia, hypomagnesemia, etc. Immunity problem. Preterm newborn have immature immune system with reduced innate and adaptive immunity. قلناها ليش؟ This immune system may be further compromised by various associated with preterm baby. طبعا أكيد يعني RDS, sepsis, dehydration, birth asphyxia, all of these decrease the immunity furthermore. Complication of oxygen. طبعا احنا نعطي الأكسجين كتريتمنت وممكن احنا by the oxygen we cause the يعني side effect or harm the baby. Oxygen can cause many problems, including pneumothorax, which is more frequent in neonatal period rather than any other time in life. It occurs about 5 to 8% of premature infants with birth weight less than 1.5 kilogram. The risk of pneumothorax is higher in patients with respiratory distress syndrome, meconium aspiration syndrome, pulmonary hypoplasia, and in infants who need resuscitation at birth. Continuous positive airway pressure (CPAP) and positive pressure ventilation (PPV) further increase the incidence of pneumothorax. يعني شغلات متعلقة بالبيبي مثلا RDS, sepsis, meconium aspiration syndrome, bronchopulmonary dysplasia. لكن أكو شغلات لا إحنا متعلقة بينا. الإياتروجينيك, CPAP, PPV. Furthermore, the incidence of pneumothorax. Surfactant and use of synchronized or volume ventilation and high rate low tidal volume ventilation. Both these decrease the incidence of pneumothorax. Oxygen also cause injury to the infant eye in form of what is called retinopathy of prematurity and lung in form of bronchopulmonary dysplasia caused by high concentration exposure to oxygen with high concentration and for long time. اللي قلناها من قبل هي الشورت تيرم complication اللي تتعلق بالبلاد GIT oxygen complication etc. لكن عندنا long term effect. long term effect are different according to the degree of prematurity. Mild prematurity or late preterm are less mature than full term baby. They have a greater than 95% of survival. Their long-term effects are not quite different from full-term baby. In moderate, high and full-term, يعني in late preterm or mild prematurity تقريبا ماكو يعني ذاك ال difference between it and the full-term baby. In moderate prematurity, about 2/3 of these premature baby will develop normally. Another 20% will have mild to moderate disabilities. About 15% of this baby will suffer from severe disabilities. Extreme prematurity, many of these babies will not survive. طبعا إذا extreme prematurity then دول survive 1/3 surviving baby هم will grow normal. Another third will have mild to moderate disability and about 1/3 have severe disability. ملخص هذا الحكي كله شنو؟ Every day, every extra day in the inside womb or in the uterus of the mother can reduce the risk of long-term problem in a significant way. These complications include cerebral palsy, impaired cognitive skills, vision problem, hearing problem, dental problem, social and psychological problem, and a chronic health issue. تعرفوا لأنهم هذول premature راح يحتاجون special care, special يعني unit, hospital, feeding, يعني feeding problem, oxygen dependent problem, etc. eye problem, etc. The last entity in our lecture هو apnea of newborn. من نقول apnea طبعا انتم تعرفون كلكم انهم respiratory cycle in the infant is not fully mature. So there is a cyclical يسموها أو periodic apnea. Periodic apnea هي شنو؟ إنه cessation of breathing but not harm the baby, not lasting for more than 20 seconds and not associated with bradycardia or cyanosis. هذه يسموها periodic apnea. طبعا هذه تصير due to immature or not fully well developed of CNS or respiratory center. لكن شو ممكن نقول على هذه إنه الأبنية هي significant apnea و important apnea بحيث إنه need our intervention. لما تكون الأبنية more than 20 seconds or any duration but accompanied with cyanosis and bradycardia. It is a common problem in a premature infant, whereas an apnea in full term is almost always abnormal and should be taken seriously. Apnea of prematurity هو disease of prematurity يعني خلينا نقول إنه it's normal occurring in the premature infant. لكن in full term it is almost always it is serious. ليش يصير عندنا apnea of prematurity؟ CNS cause extreme prematurity, intraventricular hemorrhage, hypoxic ischemic encephalopathy اللي مختصرها HIE, seizure, herniation, drugs, kernicterus, hypoxia, a neuromuscular disorder, respiratory ممكن respiratory cause, obstructive airway lesion, pharyngeal collapse, neck flexion, nasal occlusion ممكن nasal occlusion مش قد هو simple لكن cause significant apnea, pneumonia, severe RDS, pneumothorax, phrenic nerve palsy يصير طبعا دول بالlarge baby أو بشولدر dystocia, infectious sepsis, meningitis, pertussis, GIT, oral feeding طبعا direct feeding in a premature may stimulate apnea, bowel movement, NEC اللي هي necrotizing enterocolitis, intestinal perforation, cardiovascular system, hypotension, hypertension, heart failure, anemia, hypovolemia, vagal tone, metabolic hypoglycemia, hypocalcemia, hypo or hypernatremia, hyperammonemia, organic acidemia, etc. Other like hypo or hyperthermia, active or يسموها rapid eye movement, sleep, all of these causes neonatal apnea. الإيديوباثيك apnea of prematurity اللي احنا قبل شوية قلنا عنها هي طبعا occurring in the absence of identifiable predisposing disease but may be due to immaturity of respiratory central and brain system that respond to hypoxia paradoxically with apnea. يعني هو يصير hypoxia أو يصير hypercapnia بدل ما increase أو يصير stimulation respiratory central راح يصير العكس. إيش راح يصير؟ يصير apnea rather than hyperventilation, as well as there is attenuated response to hypercapnia. Its incidence inversely related to the gestational age. Its onset usually in the first 1 to 2 weeks after birth, but may be delay if there is RDS or other cause of respiratory disease. يعني ما أقدر أقول على baby عمره مثلا هو severely immature أو his age is 3 days ما أقدر أقول عليه إن هذا apnea of premature صار apnea ما أقدر أقول عليه إنه هذا apnea of premature لا ممكن هو sign of RDS نفسها respiratory distress syndrome أو لا due to يعني another problem يعني electrolyte disturbance pneumonia another cause ما أقدر أقول عليها إنه هذا الانتيتي اللي هو idiopathic apnea of prematurity بالنسبة هو idiopathic يعني without serious cause, it's occur normally. Treatment. Infant at risk of apnea should be replaced on cardiorespiratory monitor. لذلك احنا كل دول premature نحطهم على monitor. With searching for the cause of apnea. Gentle tactile stimulation is often adequate therapy for mild or intermittent episode. البيبي ما يصير عنده stimulation فإحنا راح نسوي له stimulation tactile stimulation gentle tactile stimulation ممكن كلش كافي إنه نسوي له stimulation for respiratory center and restore of the breathing. Whereas infant with recurrent or prolonged apnea may require suctioning, repositioning and bag and mask ventilation. Oxygen should be administered endogenously for hypoxia. Anemic infant لأن إحنا قلنا هي الأبنية ممكن نسوي لنا apnea of prematurity. Anemic infant can be given packed RBC to increase O2 carrying capacity. Recurrent apnea of prematurity can be treated with either theophylline or caffeine, theophylline orally or aminophylline IV. These methylxanthines increase central respiratory drive and enhance contractility of the diaphragm اللي يسموها respiratory stimulating or drugs. Caffeine citrate is more potent centrally acting respiratory agent with a fewer side effects than xanthine. Both this drug present in oral or IV preparation. طبعا preferably أكيد الأورال when the baby discharged from the NICU. Thank you for listening. Any question I will answer.